I am Dr. Hemkanta Sharma, Professor and Head of the Department of Obstetrics and Gynecology, PA Sangma International Medical College, Baridwa, Riboy, Meghalaya. Today, we are going to discuss some important points regarding malignancies of the females and also how to prevent them. So here in PA Sangma International Medical College, which is established last few years, and we have started medical college, and this time we have admitted 150 medical students for MBBS, and the classes are already started. So here we have a full-fledged obstetrics and gynecology department where all the facilities for management of all the female medical problems along with maternal care is available. So we are delivering here, then we are conducting normal deliveries, then complicated deliveries, and also we are conducting cesarean sections and also complicated gynecological surgeries. Here we have all the facilities for detections of cancers and also facilities for management of cancers, including biopsies, colposcopies, pap smear, and also different types of major surgeries. This type of facilities we are having, and we are all doing all the times. So today we are going to discuss some different points regarding this. So we know that any disease can be treated when it is diagnosed early, and in the earliest diagnosis is always the greatest opportunity for a proper treatment. So we know that the cancer is a dreaded disease, no doubt, but it can be treated if we can diagnose it early, and it can also be prevented. So we are going to discuss on that. So we already, it is known to us that cancer, though its terms is horrible or it is really scared, everybody is scared of cancer. And we also know it, cancer is a popular term, but it is actually malignant diseases. Different types of cancer, different types of diseases there, which are all known as malignant diseases, and which is a really difficult problem once it starts and spreads. But in the initial stage, if you can detect in the earliest possible time, then it can be treated 100%. And there is another important one that we can prevent it also, because we always know that prevention is better than cure. So we are going to highlight some of the important points regarding this. And the Globocon, there is a Global Cancer Observatory, which is an internationally accepted organization, which has shown very important statistics, and it places India in the third positions so far the prevalence of cancer is concerned, following China and USA. And in India, in every year, we are having 75,000 cases of breast cancer, which is the highest incidence in India. And second highest is cancer cervix, that is the mouth of the uterus, and that is also a horrible disease. And you find that around 70,000 individuals are affected every year in India. It is followed by different types of cancer like ovarian cancer, cancer of the body of the uterus, cancer of the fallopian tube, then trophoblastic diseases, then also cancers of the vulva and vagina in descending order. Now, as I told you, that prevention is always better than cure. So, how to prevent cancers? So, prevention is possible by following a healthy lifestyle. We can say lifestyle modification. And next is another one, this is called screening, then another is vaccination. So by all these methods, we can prevent it. So now let us say a few points regarding lowering the risks. How can risks can be lowered? Then one is the physical activity. So everyone should try to be active physically, not necessarily go to the gym, but you should be active. Then next, maintaining a body weight proportionate to your height, and try to keep the BMI below 25. Then next, regarding the food, that is, we have to take healthy food like fresh fruit, then vegetables, Then these are which are not, that is type of grains which are not refined. So this is always better. Then we should always avoid the refined type of grains or cereals. Then we have to avoid red meat. Then we have to avoid sugary drinks. Then we know that tobacco is a dangerous thing and it is always a precancer, or it is a risk factor for all type of cancers. So tobacco should be avoided totally. Next is the alcohol and substance abuses. Then alcohol should be avoided totally if possible. If not at all possible, at least to restrict to one drink per day. And next, coming to the other factors, like one is vaccination. And nowadays vaccines are available for certain cancers, and that should be taken whenever it is possible or when it is recommended. Then next is the screening. We'll discuss about the screening methods. That is a very important point by which we can find out the patients who are vulnerable for cancers and we can treat it in the earliest moment. And last but most important is the natural. Be natural. We should try to go as per nature. That means right from starting of a motherhood, then breastfeeding, that should be done normally. Then there should be regarding the pregnancy, that pregnancy should be in the right moment, not very early, then after 18 only. Then there should be child-bearing numbers should be controlled. That high parity is always a risk. Promiscuity is also a risk. So we should avoid all these type of things. Try to go as per nature. Then next comes the prevention of particular type of cancers. So we'll say a few words regarding breast cancers, how to avoid it or how to prevent it. To prevent breast cancers, most important thing is one is the self-examination of the breast. So that can be done every month by the person or individual herself, and that can find out some of the abnormalities which arises in the earliest moment, and they can come to the doctor at that time for further confirmations. Then next comes the screening, and also then there will be the early diagnosis, early reporting. So early reporting means whenever there is a lump, there is an changes, there is an color changes or any type of changes in the skin of the breast, they should report to doctor. Then they will subject them for investigations like ultrasonography or mammography. So screening is done as per the requirement. So for normal individuals, only after 40 we do mammography. But in other high risk patients, we can go even early. And as per recommendation, it may be at 3 years or 5 years interval. Next comes to the genital malignancy. Malignancies in the reproductive tract. So in those cases, also we should be very careful that we should report early for an early diagnosis or early prevention. Next is the screening, and third and important one is the vaccination. So in early reporting, we know that there are some early signs of cancer. So whenever there is a bleeding, especially in a postmenopausal women, after the cessation of menstruation, or there is an intermenstrual bleeding in between cycles, or there is a bleeding after sexual intercourse. So in that case, they will have to report immediately. In those patients where there is white discharge, we call it leukorrhea, and which is not controlled by conventional treatment, or there is foul smelling vaginal discharge with bleeding intermittently, they should report immediately. In some of the patients, they find there is some lump or there is mass in the genital organs, or there is an ulcer which is not healing by proper or in the conventional treatment, and they should immediately report for further investigations. Right? So next comes the different types of screening methods. What we do, how we can screen. So screening can be done as a part of master health checkup. So master health checkup should be done at least for female from 25 years to 65 years every year. And then we find that for certain type of malignancy, depending on the individual risks, that means the patient who is hereditary risk is there, where there is familial tendency, familial history of cancers are there, we have to do it every year. And in others, we can go at for 3 years or 5 years intervals. So accordingly, we go for screening. So screening methods are different. So for CS cervix, we have pap smear, we have HPV testing, that is testing for human papilloma virus, which is most of the cases it is responsible for CA cervix. And then there are other type of tests like ultrasonography, that is a color Doppler ultrasonography. Okay, so these type of things we can do as a screening method. And there is interval of screening is usually 3 to 5 years. So if you do co-test, that means we do HPV testing as well as pap smear. So we can go at 5 years interval. If you do only pap test, then we have to go at 3 years interval. So usually we do all this thing after 35 years, right? So now what is pap test and what is HPV testing? Pap testing is a very simple test. It doesn't need hospitalization. It can be done in OPD and doesn't need any anesthesia. It is not at all painful. So we can take a small scrap from the mouth of the uterus and then we do some test in laboratory and we get the report within a few days. Then HPV testing is a testing for the human papilloma virus, which is responsible in more than 90% cases for cancer cervix. And this test is a simple test for virus, but a bit costly. But we take the sample along with the pap smear sample. We call it LBC, liquid the cytology, liquid-based cytology. So in LBC, we can just collect a sample and we do pap smear as well as HPV. So this is a very informative test if you can do, and we can detect a vulnerable patient before the development of cancer, and we can remove it in the earliest moment. Now next comes the vaccination. So vaccination is also available nowadays for CS cervix, which is a very dreaded cancer and which is very common cancer. And it is one of the very important cause of mortality in female cancers. So in this case, vaccines are available which are really effective. So two types of vaccines are available. So usually the best one is the nanovalent, and that is called Gardasil is available nowadays. So which can prevent many viral diseases, not only the cancers. So it should be given at 9 years of age. After 9 up to 26 it can be given, but earlier is better. And it is not only for female, it is also advocated for males. But female it is most beneficial. So these vaccines should be given whenever an opportunity is available. Though it a bit costly, but nowadays it is available and it can be given to all the female side. And now, on conclusion, I should say that cancer is no longer incurable. So it can be cured when it is diagnosed very early. And another thing, it can be prevented when we can take proper action regarding healthy lifestyle, then screening and vaccination. So with these few words, I conclude. Thank you.